Essential oils have been used for thousands of years in managing pain and lots of other conditions, well before the pharmaceutical industry. And the current research shows that there are dozens of studies showing the role of essential oils in conjunction with pharmaceuticals as well as on their own in terms of managing pain. It's important to understand though that the same actions that the pharmaceuticals can do in the body to reduce pain can be achieved using essential oils, and sometimes they're used in combination, as you'll see. But the critical thing about essential oils is that they have many actions and different actions around the body at the same time. So it's not just about pain, it's about helping overall body, and of course using the right amount at the right time. And essential oils, for example, can affect the nervous system, the endocrine or the hormone system. It can affect your gut, they can affect your skin, all of the systems in the body one way or another. I've written a couple of, or done a couple of videos already on essential oils and migraine, and essential oils and menopause, and essential oils. So have a look at those, because they show how effective some of these essential oils are for so many things that they should be used virtually every day. That's how I use them anyway. And so we've got these essential oils. Most of them are anti-inflammatory, they're antioxidant, which is a win-win situation. They're fat soluble, so they're able to cross over the blood-brain barrier. They're able to get into the blood, travel along the blood quickly, and across that blood-brain barrier, which is a little barrier around your brain that's supposed to stop toxins and so on. And the essential oils can get in there. And in fact, there's some essential oils research with rosemary that it can get in there and actually help reverse some of the damage caused by Alzheimer's. So anyway, coming back to the pain part of it, they're fat soluble, so they're able to get to unusual parts of the body, into the cells and through the cells and so on. We know that they affect the olfactory senses, which is your smell senses, your limbic system in your brain, which can affect your heart rate, blood pressure and respiratory system in a positive rate. So hence you'll find that there's information on essential oils and all of these issues, heart rate, blood pressure and respiratory system, improving it. Wow, they're a win-win situation. But when it comes to pain specifically, we know that they can affect the opiate receptors, the endorphins and enkephalins. These are two parts of the receiving pain, the pain receptive mechanism. You heard of endorphins, and they're kind of cousins like the enkephalins. Serotonin is one of the feel-good neurotransmitters, is associated with just feeling comfortable and better. And then dopamine. Dopamine is one of the motivation. I'm in charge of my life a little bit more. Noradrenaline, which is another calming. These are all calming parts of the nervous system. And acetylcholine, which is the messenger along which all the messages from the brain and around the body and through the nervous system go. And it helps calm that down. So it helps calm down the nerve transmission. So these are some of the ways in which essential oils have been shown clinically in the lab, in vitro, with mice and in cells and a whole raft of other tests and so on, as well as humans, to be effective. And when it comes to essential oils, there is one that stands out for pain, absolutely stands out. And it's one that I practically use every day anyway, because I just love the smell of it. And it's lavender. And lavender is typically used in terms of anxiety and stress and depression, sleep and relaxation. So a couple of drops, and this is how I use it, a couple of drops on a diffuser, a couple of drops on your pillow, a couple of drops, and it just permeates this beautiful smell around. But when it comes to pain, there are many. There are a couple of dozen studies specifically on lavender at reducing pain, and in conjunction on its own, and in conjunction with a couple of other ingredients like frankincense. But here we've got the first study I want to highlight, cesarean, so post-cesarean pain. And I put these details up, and these are pretty well the details that have been shown in most of the other studies, but 3 drops used in aromatherapy, and it decreased the use of the pharmaceutical drugs. So a great outcome, because the pharmaceutical drugs all have negative side effects at half hour, 8 hours and 16 hours, which is what the study was looking at over a short period of time. So in conjunction with the pharmaceutical drugs, the people who had the aromatherapy said, I don't need as much, I feel better, I feel calm, I feel more relaxed, and I feel less pain. The same thing, vaginal delivery, so the birthing process is the same thing. Laparoscopic gastric surgery, which is the banding of the stomach, And when that's been done, and over a couple of days, the pain all declined with lavender. And we'll get the same with coronary bypass. So you can see these are pretty major operations and situations. So they're being used and tested in these situations means that, we've got some good evidence on lavender. So coronary bypass, migraine, I did a whole video on migraine and managing migraines and essential oils. So have a look at that one. But in that one, lavender jumped out again as one of the most effective in terms of managing migraine pain. How simple is that? And then you've got cancer patients and anxiety, cancer pain and anxiety. So for these people, it's long-term chronic pain, and lavender help reduce some of that pain and the stress and the anxiety around the pain and the actual condition. Again, a win-win situation. And then I listed one little study down here where they've used frankincense in conjunction with lavender and reduce labour pain and anxiety. So the message is they work. There are various combinations out there. You can buy some of these in combination, and they'll probably be called Pain Away or things like that. The message is essential oils work, but there are other ones that also can help. Another great essential oil used for pain relief, both in aromatherapy and as a rub-on, is neroli oil. Now, neroli oil, actually, the active ingredient is linalool, which is the same major active ingredient in lavender. Plus, they've got all the other additional ones which are beneficial. Now, rub-ons are quite common because many people have used rub-ons with various ingredients over the decades, thousands of years for pain relief. And of course, you've probably got some in your cupboard. But neroli oil shows up in terms of decreasing pain relief in arthritis, labour pain, and for headache. So rubbing a little bit mixed in with the carrier oils, mixed in and giving headache relief. So the studies are there. Orange oil also shows up for labour pain, and another one, Rosa Damascena, post-operative pain in children, 3 to 6 years. They looked at 50 or so children, and post-operation, a little rub-on pain, and it relieved it. And also in another study where they were dressing of burn patients. So again, fairly serious outcomes, and it was on the actual dressing itself, so you can see the benefits. This is more contact rather than the aromatherapy. Going back to aromatherapy there, you've also got peppermint oil, which shows up in terms of pain relief in a study I found in open heart surgery, and that gave some pain relief and improved the relaxation, anxiety, and sleep. And then a couple of mice studies, they do the study on mice to try and find out some of the actual mechanisms that are going on. And in this study, it was to do with the pain for heat therapy, so giving them heat, and it increased the pain threshold, so lowering the amount of pain for the same amount of heat. And it worked on the dopamine system, which is what I talked about right in the beginning. And finally, another one called cedarwood, and I love the smell of cedarwood. It's got that great woody, that's my favourite, the woody ones, but cedarwood has that great woody aromatherapy, and it led to post-operative pain, a decrease in post-operative pain, again in mice. So the studies are there, we know it works, and of course, when any pain, you always consult your health professional, but here are some really simple strategies to help with some of these issues related to pain.